All right, we appreciate you being on our panel this morning, and what's your takeaway from today from the comments and the discussions?
Sure. Well, thank you so much. This has been a lot of fun. I think it's great when you can assemble such a diverse group of individuals to talk about really a shared challenge. So I think what we've heard a lot is the need for healthcare providers to be able to come together to articulate some shared needs. That planning for the future really is important when you think about capacity or the types of technologies, and really don't skimp on the infrastructure, especially those foundational elements that are going to be critical to delivering, the best patient care possible. I also thought it was kind of refreshing to come and have quite a few discussions around policy, and that, to understand that infrastructure folks who are dealing with the actual building and design of facilities and getting the construction up and off the ground really are thinking about the full end-to-end value chain of decisions, if you will, trying to understand the necessary business models and reimbursement and their role in privacy and security and those kind of concerns. So it was, a great, really well-rounded discussion, I thought.
Well, speaking of infrastructure, tell us some of the initiatives that you're working on within the West Wireless Institute.
Sure. So I'm part of West Health, and West Health has 4 entities within it that all focus on the sole mission of lowering the cost of healthcare. We have the West Health Institute, which is a medical research organization based in San Diego, California. We have the West Health Policy Center in Washington, D.C., and we also have a West Health Investment Fund and an incubator. Incubator is also based in San Diego. And the goal here is to think about all the pieces that have to tie together to drive a lower cost ecosystem. So we have clinicians and engineers working together in San Diego to come up with new low cost prototypes or to validate solutions that are already out there. We have a couple projects that are really geared toward infrastructure challenges. One is focused on wireless and how can we help hospitals better manage wireless within their 4 walls so that they can actually be prepared to leverage the wireless infrastructure to care for their patients when they're outside the hospital. And the guiding premise there is that of all the things that you just take for granted in a hospital, be it plumbing, electricity, HVAC, wireless needs to function like that. It truly is a utility that needs to operate and behave with a known level of assurance. And there's different levels of wireless needs. So it's one thing to say that consumer devices have to be supported. So if I'm visiting my mom, I like to have my laptop working and my smartphone. That's different than the enterprise needs of the hospital itself, which needs to be able to do coding and billing and electronic printing, whatever it takes, which is also different from what we call medical grade wireless. So we're thinking about the actual devices that are on patients capturing care important data that needs to be moved to perhaps another device, perhaps into an electronic medical record. But that piece is all about getting the patient information to the right care provider at the right time so that they can make the best clinical decisions. So that's a kind of a big project looking at wireless infrastructure. And then we have some other efforts around interoperability. We know it's a huge challenge between device-to-device interoperability and then having devices be able to communicate with an electronic medical record, getting that information into and out of. So again, a big area of focus for us at West Health is, liberating data and how do we actually democratize healthcare data so it gets to the right parties, again, to give, what we think of as infrastructure independent care, giving patients the right care at the right time wherever they are, which may be in the walls of your facility and it may be outside, but those, treating practitioners need to be able to reach them.
Right. So there were a lot of technology vendors here today. What would you tell them as far as looking toward the future?
I would say really focus on the customer and the customer needs. I think we had some healthy discussion in the panel about there are technologies that are really great and interesting, but not that may be impactful for patient care at the end of the day. So make sure that it's a value-added technology and look to the community to actually implement standards that are already in place or help identify gaps in standards so that you can be part of the solution for helping that ecosystem coalesce. But I say I really give kudos to the innovation community. They are generating a lot of ideas and really doing the grunt work on thinking about how we can actually change healthcare delivery, and then hopefully payment reform will follow. But without innovation, we can't move forward.
Right. Well, thank you for being with us
Well,
today.
my pleasure. Thank you so much.
Thank you.